Hello, my name is Caitlin Anders. I'm going to be performing a skill video on tracheostomy care. First things first, I'm going to introduce myself to the patient. I'm going to go ahead and explain the procedure to them and then set them in semi-Fowler's to high Fowler's position. And then I'm going to go ahead and wash my hands, do hand hygiene, put on my gloves, my clean gloves. From here, I'm gonna see if my patient needs to be suctioned or not. Looks like they're good. I'm gonna go ahead and set up my sterile field now. So I'm opening this up, making sure not to touch the inside at all, using the 1-inch border technique. Same with my placemat. I'm gonna put the shiny side down, make sure I'm only touching the outer edges. Okay, got it. Pretend I didn't just touch the inside, sorry about that. And then I'm going to go ahead and grab my sterile gloves out. I'll put them over here. And then we're gonna go ahead and dump the contents into the sterile field. Perfect. Now I'm gonna go ahead and pour my hydrogen peroxide in this big container, and then on the 2 little ones, I'm gonna put normal saline. All right, so now what we need to do is remove the cannula from the patient. So I'm gonna go ahead and remove the dirty cannula, making sure that we're keeping the curvature so we know which way it goes back in. I'm gonna go ahead and throw that in the hydrogen peroxide. All right, and then I'm also going to remove the dressing. Perfect. And that dressing would be dirty, so I would be throwing it away, but I do not have another fenestrated one, so I'm leaving it there so I can reapply that one. Okay, now we're going to take off our clean gloves. Perfect, go ahead and do hand hygiene. And now I'm gonna apply my sterile gloves. I'm doing the same thing, only touching the outer borders of this. Thumb goes in. Perfect. Touching the cuff of this one. Okay, perfect. I'm gonna go ahead and take this and discard of it. And we're gonna go ahead and clean the cannula. So I'm gonna take this and we're gonna take this little brush thing and go ahead and clean the inner cannula, make sure we get all the gunk out. Perfect. All right, and I would discard of this. Sorry, I didn't mean to put it in the sterile. Discard of that, and making sure that we're keeping the same curvature. You can go ahead and put it in the patient, make sure it's clicked in. Perfect. One thing I forgot to do with the clean gloves was take off the old dressing. So I did forget to do that. I'm gonna go ahead and just pretend, well, we'll do everything first and then I'll remove that. So I'm gonna go ahead and put all of my like Q-tips into the sterile solution, or into the normal saline. All right, and then I'm gonna grab one and I'm just gonna kind of clean around the trach, make sure we're getting all the gunk off of the patient. Discard of that. Do another one. Discard of that. All right, still getting around. And all the crevices, discard. Okay, going around again. Discard. And one more time. Perfect. And then discard. So now what we're gonna do is go ahead and apply the fenestrative gauze. So this would be a brand new one that I'm pulling out of my container. So we're gonna go ahead and put this around the patient. This is just kind of protecting the skin, so there's no skin breakdown. Okay, perfect. All right, and like I said before, this one should have been taken off with the clean gloves. I did make that mistake, so when applying the new one, I'm gonna go ahead and use the two-step process, or one-step process, I guess. So I would just go in, securing the trach, making sure that it's not coming off or anything. Okay, and I am going to tie a knot over here so that it is secure. And I also do want to take some more gauze, fold this into a square, put this underneath the knot that I've tied, and then I want to tape down that knot so it's secure and does not come out. And then I would just check on the patient, make sure that they're doing okay, and I would return them to the lowest bed position. And I would go ahead and remove my gloves, discard of those, and do hand hygiene. And that is it. Thank you.